Hello, I'm Louise Lloyd. I'm a paediatric nurse and have been for the last 12 years, and I've specialised in children's allergies and child development and communication. I'm often asked many different questions, but I've chosen 4 of my top tips here for you today. My first top question that I'm asked is, what is a food allergy in children? My simple answer to this is there are many different foods that a child can be allergic to. However, if you're in the middle of weaning, then there's usually just 5 common groups that a child might be allergic to, and this would be milk, egg, peanut, fish or wheat. These are your 5 main groups that you would start to wean your child in, and you would know quite quickly if there was an allergy there. Your child very often may spit the food out because they don't like the taste of it. They may sort of turn their head away from you and go, ugh, ugh, no, I don't want it, especially when you're weaning. And you might think, oh, they just don't like the taste, but actually it's the body's very natural reaction to release histamine in the mouth, and therefore that gives them a very tangy, tinny taste, which makes them not like the actual food. It's quite a good warning sign for you. If they do actually eat some of the food, then what you might find is they might get some little hives around their mouth, which are little white lumps which might appear very quickly, or certainly within the first hour of them eating the food. This they might get very agitated with and find very, very itchy, and you might actually start to see some swelling around their eyes and that sort of thing. If you do see this, then it's very important to seek medical attention, either your GP or your local A&E department, and they will be able to resolve that situation for you, and you'll then be able to sort of start looking at what perhaps caused that food allergy. The second question I'm very regularly asked is, will your child outgrow a food allergy? Now, this is a little bit of a complex answer because yes, they may well do, which is fantastic. However, there's some food allergies they may not grow out of, so I'm just going to deal with in this answer those that they will grow out of. So things like milk and egg, children will outgrow very, very quickly. Usually by the time they're 5, they almost certainly have outgrown both of those food allergies. It can happen at any point during that first 5 years, and the way that this is sort of assessed is that you'll constantly go through skin prick testing and assessment with either your doctors or your local GP, and they will basically test to see whether or not intolerance has been started to be able to introduce. With milk and egg, these are the 2 allergies that, although at the time can be really restricting for your child's diet, actually by the time they're sort of 5 or 6 and starting school, actually that food allergy will have been outgrown. I now have 2 top tips on communication for you. I use something called baby sign language with the parents and children that I work with, and one of the things that I'm asked very regularly is what age you can start to use the sign language with your child. Again, there is no right or wrong answer to this. It's absolutely very individual. However, I do say that you can start using the sign language from any age, from newborn. You've got to remember it's something that you also need to learn as well as your baby. So if you do start when your baby is sort of 3-4 weeks old, then you're going to get very, very used to bringing in all of these new signs for yourself, as well as you're learning to change the nappy and you know, their sleep routine and everything else about that newborn child. I think one of the great ways of bringing it in so young is the baby will then become very used to seeing you use your hands as you talk. By doing this, they're going to be able to mimic you quite quickly, and by the time they've kind of got their gross motor skills, they will be able to start realising that you're moving your hands, and so they'll start mirroring you. This can sort of happen between sort of the ages of 6 and 8 months really. If you don't start using sign language until your child is sort of 8 or even 8 months or even older than that, again, that's not a problem because your child will just pick it up quickly because they're watching you at that point, and will start seeing you use your hands. By doing this, they will then be able to, they will already have their gross motor skills, so they'll be able to mirror you quite quickly, and you'll be able to get that interaction at quite a young age. If you do start when they are a newborn, then you do have to wait for that gross motor skill to develop in them, so they may not start signing back to you until they are about 6 months of age. My last top tip for you today is I'm often asked by parents if they're going to start using the sign language for their children as whether or not it impedes their speech. The very quick answer to this is no, it doesn't, because you're always speaking when you use the sign language, because it's classed as baby sign language. You always say the word when you make the simple gesture with them. So therefore, from a very young age, they're hearing you speak to them and learning that association between the word and the sign. If anything, actually using the baby sign language actually promotes them to speak slightly earlier. I've had many children in my classes and clinics that are actually speaking from around the age of sort of 12 to 13 months, and sometimes even short sentences utterances are being said between 13 and 14 months, which is that little bit sort of 4 or 5 months earlier than what would normally be expected. So the simple answer is no, it doesn't hinder your speech.